All right, so welcome everyone to another edition of our Health Coach Skills tutorials. So today I want to talk all about how to coach clients who have health challenges. So maybe you're a health coach who has already experienced this. Maybe you've had some clients who had complex medical histories, were dealing with an illness, a disease, a challenge of some sort, and you felt out of scope, not sure what to do. That's fairly typical because in a lot of health coach training programs, we're taught in our scope of practice that really what we should do is only work with clients who are generally healthy. So we're kind of given that guideline. And in one of the coach trainings that I did, they really went in depth on, coaching clients with all kinds of different illnesses and diseases and chronic ailments and things like that. And it really helped for me to clarify what our role and scope can be here. So, you probably have a big question of, can I even coach clients who have these kind of health challenges? And wondering if you're, in and out of scope, because as we all know, we're not doctors, we're not physicians, and so we can't diagnose, prescribe, and treat. That is definitely not within our scope of practice. But absolutely, there are lots of things that we can do to support these types of clients, and that's really what I want to share with you today. I've got some tips and just some general guidelines of how to handle this kind of situation and what we can do as health coaches. So like I said, one of the health coach trainings I did really went into detail. You'll see me, I'm just looking down at my notes. So they really went into depth on how we as health coaches can help various clients with things like heart disease, surgery recovery, diabetes, cancer, metabolic syndrome. So lots of the chronic illnesses, we absolutely can be of support to our clients in that way. So like I said before, most of us are working with clients who are generally healthy, for the most part. And what we're doing is we're coaching them to, on the prevention side so that they don't get, chronic illnesses and diseases down the road. However, there will absolutely be times when you get a client who does have a serious medical condition and, it's really not clear, what should you be doing with those types of clients. So of course there are also lots of other health coaches out there in the world who are working directly with clients who have medical conditions. They're in hospitals, they're in clinics, they're in rehab centers. They're working as part of healthcare teams. And that's, amazing. A lot of medical professionals have also gone on to do a lot of coach training because they realize the importance of not only, having their client be medically compliant with prescriptions and recommendations and therapies and such, but also helping them with those lifestyle changes. So that really is the part that we can help with. So absolutely, health coaches can support clients with health challenges. We just need to do it in a coach-like way, coming from that coach mindset and through the coach approach. So that's really what I want to share with you here today. So first I want to just talk about what are the different areas around, or under that title of, or under that heading of health challenges or medical conditions that we can help with. Because there might be some areas that you haven't even thought about. So we could help someone who maybe has just received news of a death, a tragedy, a trauma within their family, within their community, and just dealing with and processing some of that kind of emotion and feeling. And we talked about emotions and feelings last time. We can also help someone if they got a recent diagnosis, right, of a chronic illness or disease. Absolutely, we can support those types of people who have just gotten that news. We can help someone who's had a health scare or a health event. Maybe they've had a heart attack, a mini stroke, they get negative lab results, or they have an injury or an accident. Absolutely, health coaching can support those folks. And also we can, generally support our clients dealing with signs and symptoms of aging, right? We might not want to call that a health condition, but it's something that's happening as a regular part of life that might be difficult, for some people to transition into. So absolutely supporting folks dealing with that kind of thing. So the number one thing that I want to say about, working with clients with health challenges is that number one, you are supporting them in implementing those recommendations, the prescriptions, the therapies, and things like that they've received from their medical care professional. So that's where we come in, right? We kind of fill in the gap. They get recommendations, they get prescriptions from their medical professional, and then they go away in their day-to-day life, and they're not quite sure how to implement all of that. So that's a really important role that we play in sort of filling in that gap in the healthcare system today. So helping your clients implement and stay medically compliant, right? Just complying with all of those recommendations that they've been given, because it may be very overwhelming after surgery or, moving through a disease, getting treatment. What do I do now? What does my life look like now? And that's really a great place where a health coach can come in and support your client. So the other thing that I want to say, that if your client is going through treatment, if they do have a serious medical condition, an illness, a disease, they really do need to be under the active medical care of a medical professional for you to work with them, unless, they have received, permission from their healthcare team, to work solely with a health coach. So you really do want to make sure that they're getting that other primary care, that they are working with a physician, a specialist, doctors, whatever the case may be. The other thing in terms of our role here is really that our role is to help with the lifestyle implementation, right? So all of those other things, the primary food, the secondary food, all of those things that really can support your client in either moving through a disease or an illness, or dealing with the emotions and feelings around it, or after in sort of that recovery mode. So those are two key things to remember, right? We're helping them implement those recommendations, and as well, we're helping with the lifestyle aspect. So what I want to share with you now, because I think a lot of us are maybe doing things that are out of scope, or thinking of putting plans in place like this. So I want to talk about what health coaching in these types of situations does not look like. These are things that we should not be doing as health coaches. So we should not be prescribing, diagnosing, or treating, right? We know that that's out of scope. We're also not prescribing various programs or diets, exercise regimes for particular illnesses or medical conditions. That is not within our scope. We're not also providing regimens or protocols for, how to be healthy and well. We don't prescribe. We're not consulting or counseling either, right? That's not what we're doing. And it's not about us trying to just, continuously provide suggestions and trying to solve our clients' problems, or explaining to the client what they need to do to be healthy and well. They've gotten that from their physician, and, we're really helping them implement that. And as a health coach, it's not about having all the answers or all the information. So do not feel that you need to go out and research every illness, ailment, and disease so that you can be knowledgeable. That we go to doctors for that, right? There are other professionals for that. That's not what health coaching is. So what is it? Our role as health and wellness coaches is really to support that client, as I said before, in changing their behavior and making those lasting lifestyle changes. So I want to share with you sort of some tips on, what does that look like for us? So as health coaches, what can we do within this sort of scope of helping people with medical challenges? So I've got sort of 12 tips here, or areas that we can help in. I think there are probably lots more, but I think these are the top ones that come to mind for sure. So number one, we can absolutely be their ally. We can give them, that committed ear, that dedicated person person who's really going to listen to them. We're going to help them explore, the emotional connections to their illness or disease or whatever health event that they're going through. How are you feeling about all of this? I mean, just that basic question, and allowing and giving them an opportunity to just share and open up and have someone just listen to what they're feeling and thinking about whatever, this health challenge is. We can absolutely help them take stock of their current health and wellness, assessing their current state. So where are you right now? What can you do? What is your situation? How do you feel about it? So just, taking that stock, let's just really go back and really find out where you are right now. Of course, as health coaches, we can also help them get really excited about the future. At this point, they may be feeling really down. Their dreams, desires, things that they wanted to do in their life might not be possible now. So what we can help them do is develop that new vision for a future, right? So what does it look like? What can you do? How can you find that joy and purpose, even though you might have gotten some really bad news, had a great loss, going through grief, or been diagnosed yourself with an illness, or recovering from surgery or an accident. What does life look like, for you now? What is that vision that you hope for? Really important work to do here with them. We can also help the client assess and really develop the readiness for change. So maybe they're not ready for a lot of action now, if they're coming out of a surgery. But again, readiness for change is all about, in these instances, what can you do right now? Maybe you're just thinking about things. Maybe we're just putting plans in place. Maybe we're developing agreements and commitments of things that you want to do. And again, thinking about that longer term vision of what you'd like to achieve once you're able, to be able to start moving toward those goals. So helping them develop that readiness for change and what can they do right now. We can also really help our clients commit to those various lifestyle prescriptions that they might need to make, right? And I'll get into that in a minute, but it's all about that medical compliance, right? What have their physicians, doctors, surgical team, what have they told them that they can and can't do? And we can hold them accountable to those kinds of things. We can also help them, with medication regimes, developing a plan for getting to all their medical appointments, getting to rehab therapies and things like that. We can be sort of, I like to call it like kind of the project manager, right? We're looking at the big picture of everything this client needs to do, and we're really helping them break it down, make it manageable, take away some of that overwhelm, because this is going to be a lot for many people, right? They're dealing with the emotions and feelings. They're dealing with all these lifestyle changes that they have to make. This is all really new to them. So we can be really like an incredible support, ally, and guide in this phase of their life. We can, once we figure out those plans for our clients, we can really help them commit to those action plans, right? And these are all around those healthy lifestyle changes that can actually support their medical conditions. So for lots of people, their doctors now might be actually giving them lifestyle prescriptions, right? If they have a forward-thinking physician or doctor. But we also might, talk about this to the client, and they may have to go back to their doctor and say, well, what can I do around exercise? What should I be eating? What are the best methods that I can do to, manage my stress? So these are areas that we can absolutely support the client in, committing to those action plans and coming up with agreements around. So everything from increasing their activity, improving their diet, reducing stress, getting more rest, finding connection and support in their life. Who are those other people who are on their team who can really support them? We can also help them in reducing some of those harmful behaviors that maybe they were doing before, things like smoking, alcohol, especially with illnesses. And of course, we can help them explore hobbies and interests. This kind of gets back to finding the joy again, and what is that vision, and what can they do, and what could they get excited about in their life now. So those are those lifestyle pieces that absolutely we can help them develop plans around. And again, if they're unsure of what they should be eating or what they can do for exercise, we would recommend that they go back to their doctor, they get those prescriptions right, and then we can help them implement those. Another piece is around environment, right? Maybe they need to make adjustments in their home environment to, accommodate whatever they're going through. And so we can help them develop plans around that or source resources and things like that. So lots we can do there. We can also help them work through poor habits and develop new ones, right? Again, if they need to develop better habits around eating and exercise and stress and sleep and rest, all those things, absolutely we can help them with those plans. We can also help them work through those obstacles and challenges and setbacks, right? In a recovery phase, or, as they're going through, maybe a treatment plan or what they've been recommended, in terms of dietary and lifestyle changes. We know that lifestyle change is not a straight line. We know that it's circular and cyclical, and that our clients are going to fall off track. So we can be that person who is there for them when they do, to help them get back on track. We can also be great resources for them to brainstorm ideas. Maybe they're just at a loss of what they can do, or, what things look like. So we can, brainstorm with our clients. We can help them educate themselves, right? We don't do a lot of teaching and educating around specific diseases or illnesses unless we've been trained in that. But what we can do is help our client figure out what they need to learn, right? What don't you know? Have you done research on what the best diet is for your illness? Have you looked at, all the different things that you can do around exercise? So helping our clients educate themselves is a great conversation to have. And also we can help them find other professionals who they might need, to gain support from. So referrals and things like that. Absolutely. And then finally, I've kind of mentioned this sort of in some of the other tips, but we can really help these clients rediscover, the fun, the joy, their interests, creativity, hobbies, things that they can do. Again, they're going through a lot. It's very emotional. Their health has been probably their number one concern if they've gotten a diagnosis. And so maybe they've forgotten about, some of those other primary foods, those things that can really nourish our client back to health, whatever that looks like for them. So it really is important for us to focus on what they can do and where can they find the joy and what do they love to do, right? And see if we can bring that back in for them. So just to kind of sum all this up, just a few general guidelines that I have for you of the coach approach when it comes to dealing with clients with health challenges. So number one, we want to meet our clients with compassion and non-judgment. We just really want to be that committed listener, to really be that person who listens as they're going through whatever they're going through and what they're dealing with. We always want to distinguish between coaching and treatment, right? We are not in the business of treating. We are not in the business of healing. We're in the business of coaching and behavioral change and lifestyle change. So that's really, we want to distinguish that. We want to fit our coaching to the client. This is all about meeting them where they're at, right? We can work with clients at any stage of change. If they're in pre-contemplation, contemplation, planning, action, we can coach them throughout the entire range of readiness for change, but we meet them where they're at, absolutely, and we coach accordingly. We can be the ally for our client, we can be there for them, and also be also an ally maybe for their treatment providers, right? Maybe we do develop a relationship if we get permission from the client to do so, to actually become part of the treatment plan, right? So we can be that ally in between. We can coach our client absolutely around what they can do. I think this is the theme here today. What can the client do and what can't they do, and coach accordingly again. We can be that great listening ear for them to share their feelings, their emotions, what they're going through, whether it's loss, grief, frustration, anger, disappointment. All of those emotions are going to come in here, right? And we talked about emotions and feelings last time. We're not psychoanalyzing our clients here, but we're absolutely providing that great place for our clients to get that out into the open. We can, as I've said a couple of times here today, we can coach for medical compliance, which is all about the client complying with whatever those prescriptions and recommendations they've been given by their healthcare team. We can help them implement, develop those plans, And we can help them track, right? We can help them track their progress and stay on track with those kinds of things. And then finally, I think that the biggest thing here is we can really help our clients reclaim their lives and, reimagine a new one that, those dreams and desires that maybe they had before this health challenge, are gone. There may be things that they are absolutely no longer able to do, but we can help them reimagine a new future and what that looks like for them, through our coaching support. So those are some tips that I have for you today. I hope this has been helpful. I know a lot of coaches have had clients like this, not sure what to do, not sure if this is in scope. So I hope this has helped, to clarify some of that. If you have any questions about any of this, please post them in the comments below and I'd be happy to answer those. As well, if you're not yet part of my community online in Facebook, I'd love to have you come join me over in Coaching Skills for Health Coaches, where we talk about these kinds of health coaching topics each week. So hope to see you over there. Have a great day. Bye for now.